is the former Lieutenant Governor of New York and a patient advocate. Betsy, welcome.
Thank you, and here it is, the new health care law.
Well, and we're all getting familiar with it, and it's very clear that people don't like it. Is what the president's doing, going on the road, Betsy, is he really just trying to regain lost ground? What's going on?
That's right. He's trying to convince the American people that this law rammed through against their will is actually to their benefit.
It's $25 million, this PR tour, and we don't even know how long it's going to go on for because they're raising money in the private sector to take it.
But more than the money, the government is becoming a lie machine. For example, the president isn't admitting that for the first time in history, under this law, government is going to dictate how doctors treat privately insured patients. That means if you've got Aetna or Cigna or some other brand name plan, the government is still in control. Section 1311 of this law says insurers can pay only doctors who do whatever the Secretary of Health and Human Services dictates, is redistributional. But the worst news for seniors and for baby boomers who are counting on the kind of Medicare we've always had is this. Seniors have always been able to pick up the phone, call a doctor who takes Medicare, make an appointment, go for treatment, and the federal government pays.
Right.
Not in the future. Berwick wants people to be put into medical homes where you have to get permission from a nurse or a physician's assistant to see a doctor, much less a specialist.
Betsy, go to Berwick's point here, though. Does health care reform require redistribution of wealth? Do you have to take away from some people to give other people services? Is it a requirement?
No, but that's what the Obama law has done. It has taken $575 billion out of Medicare and shifted it over to fund a near doubling of Medicaid.
Right, and I think that's one of the things that people are so upset about. To talk about this idea, they say that's not true, that's not what we're doing. But if you're going to make these numbers work, if you're going to make the math problem work, don't you have to ration health care under the terms of this bill?
Well, that's right, and a new brochure has been sent out to all Medicare enrollees, and it is full of half-truths.
I want you to talk about these. There are misleading statements in this. It's gotten a lot of coverage, but not enough in my view.
It's more than misleading. They're lies. On page 1, it says, your guaranteed Medicare benefits won't change. Well, for the 11 million Americans who are in Medicare Advantage plans, they're going to be losing some benefits because the federal government is going to be paying those health insurance companies less, and in turn, they're going to cut back on things like dental care and gym memberships, things that people in Medicare Advantage have gotten in the past. Also, the chief actuary for Medicare just issued a report.